Good morning, you guys. It's great to know that you are all with me from the comfort of your own home. Hopefully all doing well. Obviously, without the format of questions right here, I'm just going to kind of run through the kinesiology for the lower extremity, seeing as how we're about to embark upon PLEC, which are all the muscles along the bottom of the foot, back of the calf, posterior thigh, and glutes. So we need to kind of look up that chain and examine each joint that these muscles are going to affect. Now, for seniors, you guys have been through this already with the anterior lower extremity. So for posterior lower extremity, juniors, this being your first time, I'll try to pace it nice and slow. Of course, we'll have a little Q&A after this, but again, I know I sound like a broken record, but it's incredibly critical that you guys really spend time understanding the mechanics of these joints. And just remember that joints are just the spacers between bones, and the shape of that space really determines how the movement is allowed to happen or not allowed to happen, meaning which planes it's going to move in and which planes it's not going to move in. And then from there, we just have to put the muscles that move in those planes, okay? Which is what we study next. So we're gonna start from the bottom distally, and we're gonna work proximally. So we're gonna go from foot to hip. Let me put my coffee down there, okay? And we'll use the aid of Mr. Skeleton here, and we're gonna start with the feet. Now, for juniors, talking to you, we just went over movement nomenclature. So we talked about the name of motion. So you should be somewhat familiar with these, but these toes, these digits, you will notice have multiple bones. So we're not talking about this row of 5 here. We're talking about these digits, these toes. You'll notice that there are multiple bones, which means that there are multiple joints within the toes. We call these interphalangeal joints, okay? And you might also notice that for the big toe, there's only one joint because there's only 2 phalanges. However, for digits 2, 3, 4, and 5, there are 3 bones, which means we have 2 joints. The way we differentiate these is with the terms dip and pip, which is the proximal interphalangeal joint and the distal interphalangeal joint, okay? All that said, every interphalangeal joint in your toes are classified as a hinge, which means that 1, it moves strictly in the sagittal plane, which then 2 means that they are going to perform their version of flexion and extension, which in this case is just flexion and extension, okay? All that to say that your toes bend down and they bend up, but they don't do or allowed or permitted to do any other kind of motions, okay? Now you might be saying, well, don't the toes spread apart and pull back in? Indeed they do, but that movement is not occurring in the interphalangeal joints. That movement is occurring in the space of what I call the foot. So these are the metatarsals. So where the metatarsals meet the phalanges, which are called the metatarsophalangeal joints, okay? Or where the metatarsals meet the tarsals, the tarsometatarsal joints. So this row here, this is where we are getting frontal plane motion, right? So these joints are able to move in the sagittal plane, and they are also able to move in the frontal plane. So who can remember a name of a joint or a classification of a joint that moves in the sagittal and the frontal plane? Did you think of it? It's a condyloid. Condyloid moves sagittal and frontal. Perfect. Okay, from there we have our intratarsal joints, or our collection of tarsals. Most of them are not of interest to us because they're just gonna glide sort of back and forth, sort of flat surface to flat surface, so we don't need to worry about those, except for the big ones in the ankle. So, pardon me, I'm gonna slide this a little bit closer so we can get a better view here, okay? So I'm going to turn this upside down for a second and this way. So you might notice here is your tibia. Okay, obviously the ground would be here. This is inverted. Underneath your tibia is a bone called the talus, which is a tarsal bone. And then underneath your talus is a calcaneus. So the joints that are occupied in those 2 spaces are of great interest to us. Okay, the first one is going to be where the talus articulates with the calcaneus, what we call the talocalcaneal joint. This is a gliding joint, so it's an arthrodial joint. okay? But it is a big time gliding joint. It is one of, again, great interest to us, and that gliding in and gliding out like the base of a rocking chair. Okay, I can't do that with this foot because it's bolted down, but that would be what we call inversion and eversion. You guys know those motions, right? Turning your foot in, turning your foot out. It's sort of the frontal plane motion of our ankle because we don't get AB and adduction there. All right, that movement is accomplished by the subtalar joint or the talocalcaneal joint. Both terms work fine, okay? That's a gliding joint, inversion and eversion, okay? If we go proximal to that, we'd have our tibiotalar joint, okay? Anybody remember an interesting fact about the talus? That's right, it's the most weight-bearing bone of the body. Good job. Okay, so in that space, in the tibiotalar space, okay, we have another hinge. So previously we talked about hinges as interphalangeal joints. Well, we have another hinge here, which means it's going to move in the sagittal plane, and it's going to be limited to its version of flexion and extension, which in this case is going to be pulling the foot up and pulling the foot down, right? Foot up, right? This is my foot. Foot up we call, that's right, dorsiflexion, and foot down would be plantar flexion. Great. So that covers the ankle and foot, okay? So interphalangeal joints, hinge. Metatarsophalangeal and metatarsal-tarsal joints, condyloid. Subtalar joint, gliding, tibiotalar joint, hinge, right? From there, we can move up to the, well, typically it's called the knee, but is the tibiofemoral joint, okay? And the tibiofemoral joint is another hinge, but it's different. So we call it a modified hinge. It's the only modified hinge you're gonna run into. And that's mostly because the knee not only performs flexion and extension, but in a human body, when we are in flexion, we are permitted to rotate. Obviously, it's not going to be that rangy, but we get some degrees of rotation there. You might know it in the movement world as a pivot. So when you pivot around your foot, hopefully your knee is flexed when you do that, like slight bend in the knee or it's not going to work. That is you rotating your tibia on your femur. Really important motion, one that we will assess in great detail with hamstrings coming up soon. And we'll do that, of course, by video if need be. Really simple assessment, but really powerful in treating potential knee issues, hip issues, all that stuff. Can really mess up the whole chain top to bottom, okay? So that's tibiofemoral joint. There are other joints here that we don't talk about, like the patellofemoral joint. It will come up in pathology lecture, which I wanted to say tomorrow, but it'll be today because we're kind of covering it all now. So, okay, but that is the patellofemoral joint. It's there, but it's not really a highly mobile joint, so we just need to worry about that tibiofemoral joint as a modified hinge, sagittal plane, transverse plane motion, okay? Which leaves us with the most mobile joint, which is the hip, what we call the acetabulofemoral joint, okay? And this we are going to classify as a ball and socket joint, which means that it's moving in all three planes, right? Sagittal plane, frontal plane, transverse plane. So we're gonna get flexion, and we're gonna get extension. We're gonna get abduction and adduction. We're also gonna get internal rotation and external rotation, or medial and lateral rotation. So we get all 6 of the big movements in the hip and all 3 planes of motion. So that's the kinesiology, guys. Again, the main thing you wanna go through, there's a chart that you guys have with all this stuff on it, and just remember, by those charts, you need to, again, I implore you guys, it's not just about memorizing. You really need to understand this stuff to be a good clinician. But for now, memorize, go through the chart, be able to recall, hey, tibiofemoral joint, how's it classified? Great. That means it moves in what planes? Awesome. So what movements are available in that joint? Great. And if you can nail that down, you're going to find that when you get to muscle lecture, you're like, that makes a lot more sense. So you mean to tell me the knee doesn't move in the frontal plane, so we're not going to have any muscles moving the knee in the frontal plane? Well, certainly not, because that movement doesn't exist there. So it really does simplify what will ultimately be a pretty difficult task of learning all the muscles, okay? So that's the kinesiology. We're going to switch now to a little bit of Q&A if you guys have any questions for me, and then we'll move on to the next video.